welcome back to my channel. If you don't already know, I am Alex. I am a second year children's nursing student and I'm currently on placement in the children's emergency department. This video, as always, is sponsored by nurses.co.uk. All their links will be down below. They have great blog posts written by nurses, by student nurses. They have a load of job opportunities on there for qualified nurses, so make sure you go check them out. So this video, I'm kind of going to split it into two parts. As you can tell by the title, it's all about how the pandemic has changed student nursing, what is not happening anymore, what's changed, what is happening. So I'm going to kind of split it into how it's affected my course and how my course looks now. So like what it looked like before and what it looked like now. I know I just repeated myself, but initially, obviously, when I was in first year, the course looked pretty linear. It was 50-50 theory and placement. We learned a lot of basic skills before we actually went out into clinical practice, just to make sure we knew what we were doing and that we had a good introduction to children's nursing as a whole, both the care side and the theoretical side. So first year was going really smoothly. You know, we were able to actually enjoy the social side as well. Like, you could go clubbing, you could go to social events and meet people, you could chat to people around the uni, in the library, wherever. And obviously you're going into lectures with the whole cohort or whoever was in the lecture, and that would be filled with quite a lot of people. And sometimes you would have like a whole day of lectures or like a whole morning, and I would have one clinical day a week, which was like the only full day in my timetable, which was where we were in the labs using all the equipment and kind of practicing clinical skills. So that's what it kind of looked like. I would go to uni maybe like 3-4 days a week, and then have that it was a one Thursday every week for my clinical sessions. That was what my routine looked like. And then when I went on placement, obviously that would all stop. Uni was kind of put at a halt, and then I went to the hospital to do my placement. So I was on my first full placement in March. I did 6 weeks on a general peds ward, and then right towards the end of that 6 weeks I went back to uni for one day, and then they said don't come back, and the week after we went into lockdown. So it was all a bit like, whoa, what's happening? Because obviously we still had exams coming up in the May, and we had another placement coming up in June where we were supposed to do 5 weeks in a hospital and 1 week in a school. So obviously that got cancelled because it was only second years and third years that could opt in to carry on doing their placements and get band 4 salary. So we were at home doing online work, doing online exams. None of my exams got cancelled except the one clinical skills exam, or the OSCE, obviously because that's a face-to-face exam where you're doing skills in front of the examiner, so that clearly got cancelled, but they made like an online version of it. So I had assignment exams to do and like multiple choice online exams to do instead, which were kind of what determined whether you went into first year or not. We'd missed a lot of placement hours because that placement got cancelled in June. Everything was just all over the place, like having Zoom lectures and all this and that. And obviously our term finishes in every year, it finishes in like mid-July. That time where we were supposed to be in placement, we had like nothing to do. So they moved our pharmacology module from second year into first year to kind of fill up the space. And it was just all a bit of a mess, to be honest. We were just kind of, everyone was exhausted. Like the lecturers and stuff had to work on their feet and kind of think, okay, how are we going to fill the time? How are they going to make up for their hours? How are we going to make sure that they don't miss out on good quality training? They did amazingly. Like, they were so good with communicating like what was going on, and they were really good on checking in on us. So like every week we would have a Zoom call, and they would ask us if we had any questions. They would ask how we were doing, like mentally, emotionally and physically as well, asking if anyone had gotten ill with the virus. But yeah, it was a really strange time. And then obviously we had the summer break. Just having kind of lectures uploaded online that you can just do in your own time. Obviously they've got a schedule for us, but unless it's a live lecture, we can just do it in our own time. It's just uploaded online. As long as we do it, it's done. It was really strange adjusting to being in a lecture hall full of like over 100 people and having a lecture face to face with a big screen and sitting in the hall, and then to sitting in my bedroom on my desk with my computer in a Zoom meeting or a Teams meeting. It's just so strange, and I feel really sorry for first years now, because Obviously you guys don't know what that experience was like before COVID, before all of this madness. So I think probably that's the biggest thing that's changed, like having that transition from normal lectures to online lectures, which is not worth the £9,250 at all. My uni are doing amazingly, but it's just online uni is just not the same, you know, like it's not worth paying all that money for. I think the government neglected students really, really badly. So none of it is the university's fault. Like, my lecturers have done absolutely amazing, but the government, they have some explaining to do, because another thing that's changed, I guess, is the placement situation. So obviously I'm in placement now. I missed a lot of hours from the summer, which I have been able to kind of make up some of them on specific online work that was set just before I went on placement to kind of aid my learning or my practical learning, which gave me an extra 75 hours to add on to my clinical hours, which is going to help, and they're going to give us another opportunity to get another 75 hours through online work in third year, which is going to help so much. We're still going to have the same amount of like theory and practical time this year, but obviously it's very different. Like, coming into a hospital, everyone's in different parts of the hospital, everyone's on different wards and things, where some areas are more at risk of having COVID breakouts. Some people are even on COVID wards, some people are on places with lower risks. It's very different being on placement now, because before, obviously, we would wear PPE and different levels of PPE depending on the type of patient you're dealing with, but you wouldn't have to wear a mask to go and see any patient. You wouldn't have to wear gloves like constantly, unless you were, you know, doing something where you needed to wear gloves. I don't know, like if you were going to take a cannula out or something. Not being able to smile at patients I find so hard, especially because I'm doing children's nursing. I find it so difficult when I'm trying to get them to like open their mouth to take their temperature, or to just smile at them, just to be nice or to be reassuring. You can't even smile with the mask on, and that is so annoying. And wearing a mask for 12 hours is not very nice, but protection is key. Obviously the social side of uni has changed a lot. Like, you can't go into uni and chill, like you obviously can't really go out like that or in big groups of people. With my clinical skills module, so far in second year I've had one clinical session, and the groups are so tiny. The session, instead of being the whole day, it's only 2 hours now. Everything is we're all distanced, everything is cleaned. Like, once one person uses a mannequin, for example, then the teachers clean it down for the next person to use. We're constantly washing our hands, obviously wearing masks the whole time. It's just a crazy world we're living in right now, and adjusting to this new way of like learning and being a university student is so different, especially now, like, because I'd only just got used to what it was like before, and then COVID happened, and it was just like you're having to get used to a whole new way of living and a whole new way of studying, which I think has been quite hard for a lot of us, but it's just something we had to adjust to very quickly, and I think we've all done really well in adjusting to that. I think just having the right support system around you helps so much. And one of the big things that actually breaks my heart that has changed being a nursing student for me is that second year was supposed to be the year that we could do our elective placement. Me and my friends wanted to go abroad for 4 weeks and do our placement in another country, but obviously we can't do that anymore because pretty much every country is on the quarantine list, and obviously some countries are a lot more high risk than others. And like, getting on a plane and going away for 4 weeks, you don't know what can happen in 4 weeks. Like, you might get stranded if there's another lockdown. Like, everything is just so up in the air, you can't plan in advance. So not going to be able to do that, and there's no time to do it in third year, so I'm really bummed about that, because before I started the course that was something that I really wanted to do, which is a shame, but obviously there's more important things going on at the moment. Some people are going to get the opportunity to do an elective, like nationally or virtually, I think. I don't know how that's going to work, but I'm just going to do another regular placement because I don't want all the stress and the hassle of having to organise something that might not even work. Other than that, I think everything else is the same. In first year, all of my exams were supposed to be online, other than the OSCE anyway, so that wasn't very different. It is just really hard to adjust to online learning and to adjust to the new way of living socially as well. I know even if you're not a student, the whole like social distancing thing and the limits to 6 people when you go out and the curfew. Like, it's all very limiting, which is hard as a student because you want to be able to go out and meet new people. You want to be able to kind of party and just enjoy yourself and enjoy this new stage in your life. But obviously that's not normal at the moment. Nothing is normal at the moment, and we just have to persevere. We're all in the same boat. Every student nurse at the moment is in the same boat. It is a struggle. I think it's a much harder struggle than a normal uni student because we're juggling, adjusting to this new kind of COVID uni life and also adjusting to COVID placement life and juggling both, and it's all very emotionally draining as well. It can be quite isolating. I hope what I've just said has kind of made it clearer to you as to how the pandemic has changed student nursing, and I think it also makes it more important for you to look after yourself and to look out for other people, because change is daunting. This type of change, especially because it's quite a big life change, being a full-time student and having your whole routine just shifted and having your expectations flipped as well, it's a lot to deal with. So just look out for each other, look out for yourself, and make sure you're taking care of yourselves and one another, because it's just it's a very scary time. Even though we're out of lockdown, it's still a very scary time. Like, corona hasn't disappeared. I think that's all I really have to say. I hope that made sense. I think it was easier for me to talk about the transition and how it was pre-COVID and how it is post-COVID, during COVID. I don't even know. We're just living in a world of confusion at the moment, but I just hope that everyone stays safe and everyone stays well and as organised as they possibly can. And yeah, thank you for watching the video. If you liked it, don't forget to like, comment and subscribe. Don't forget to check out nurses.co.uk, and I will see you in my next video. Bye!